behalf of our Yoga University of America and then my students, heartily I welcome you, Dr. Pranayama. Please.
Thank you, Dr. Devaki Madhav,
Good morning, sir.
for giving me this opportunity. I thank the organizer as well as Dr. Devaki in particular. Shall I start now?
Yes, sir. Yes, doctor, please.
Yes, I am Dr. Praladra from Mysore. So, everything has been introduced by Dr. Devaki Madhav. Today, I am going to talk on impact of cardiovascular pranayama on cardiovascular system in general, heart in particular. As you all know, pranayama increases the oxygen concentration in the blood. I am not going to in detail about the different pranayama asanas that will be dealt by some other speaker. So when the oxygenation in the blood increases, it supplies all the organs with oxygen, and naturally the heart rate and the respiratory rate will come down. You know, the main component of the blood is RBC, red blood corpuscles, WBC, white blood corpuscles, platelets and plasma. Mainly the RBC is responsible for the red color of the blood. RBC is a biconcave disc-like cell containing hemoglobin. See, the disc-like cell, spherical, it is not spherical, it is a disc-like cell that increases the surface area of the RBC wherein much of oxygen can be absorbed. The hemoglobin actually combined with the oxygen, it is a carrying capacity of the oxygen. So the main function of hemoglobin is to carry oxygen and nutrients to all parts of the body. So naturally, when RBC count will come down, that means in anemia, or the RBC structure is malformed. Sometimes it is spindle shaped, microcytic, that means size it will become small. So then naturally the oxygen carrying capacity will come down and the heart rate increases. Why heart rate increases? Heart has to pump more blood to get the sufficient oxygen. And naturally it is associated with the increased respiratory rate. When you do pranayama, by taking deep inhalation and fast exhalation, the air and oxygen goes till to the terminal of the alveolus, where the alveolus, the carbon dioxide and oxygen dissociates. Exchange of carbon dioxide with oxygen occurs. And when you exhale it, whatever the carbon dioxide deposited in the body, you will throw out. Even increased amount of carbon dioxide also causes alkalosis and acidosis in the body, that increases the respiratory rate. There are many people with increased carbon dioxide level in the blood. And regarding this oxygenation, when there is no proper oxygenation, I will tell you few conditions. I have told about the RBC condition, respiratory condition like asthma, COPD, chronic obstructive pulmonary disease, ILD, interstitial lung disease, or even high altitude, we will get less oxygen. So in such case, whenever there is less oxygen, body will get oxidized, producing free radicals. So these free radicals act as inflammatory agents and causes damage to the nerve cells, cardiac cells, blood vessels and whatnot, all the organs, when there is lack of oxygen. So that we call it as free radicals. So to get rid of the free radicals, you have to do pranayama, you have to take good food like good vegetables and fruits that act as antioxidants. So because of lack of oxygen and wrong food, the body get oxidized. So we have to use antioxidants like fruits and vegetables and pranayama. So whatever the free radicals collected in the blood, you can get rid of it. So that means the body is detoxifying the toxins, and thereby it improves the mind and body condition. So can I share some slides? Option is not host disabled participant screen sharing ante host disabled. You just allow me to share the
Suma, Ravi, screen sharing na enable ಮಾಡಿ. Suma,
okay. I will continue it. ಆಯ್ತಾ?
enable ಮಾಡಿದ್ದೀರಾ?
No, it is disabled.
Ma'am,
To know the effect of
Just enable sharing to the
done ma'am, it is already done.
yeah. So the impact of pranayama on cardiovascular system. On the left corner upside, I have shown the Shiva doing meditation. That means this pranayama is not a new one. It is a age-old ancient procedure to improve the condition of the brain and the mind, improvement and oxygenation. This I have told, pranayama increases the oxygen level in the blood and reduce the respiratory rate and heart rate. So during inhalation, the air enters the respiratory tract, goes till to the terminal alveolus. Alveolus means there is a thin membrane wherein the oxygen and carbon dioxide exchanges. So during inhalation, oxygen is taken over by the blood. During exhalation, carbon dioxide is excreted. So there are so many conditions, abnormal condition of gaseous exchange I have already told, like COPD, chronic obstructive pulmonary disease, bronchial asthma, high altitude and interstitial lung disease, and deformation of the RBC itself, like a small RBC or a spindle shaped RBC, etc. And before going to the detail, I will tell little bit about the anatomy of the blood vessels as well as the heart. As you see in this picture, there are three layers. I am not going to the other layers in detail. The innermost layer is called endothelium. This is very smooth layer, and whenever there is oxygenation completely occurs, this endothelium produces nitrous oxide. Nitrous oxide improves the vasodilation. It causes the vasodilation of the arteries, veins. That's how it improves the circulation to the terminal vital organs like heart, brain, lungs, etc. So this is about the normal. I will tell later about the pathological aspects, and I will coming to the health of the blood vessels and the heart is affected by high blood pressure, high cholesterol, diabetes, kidney disease, valvular heart diseases, and congenital heart deformities, and obesity, and sedentary life. Even sedentary life also leads to all these such things. So coming to the anatomy of the heart, as you all know, it is situated in the left half of the chest wall, chest cavity, and it contains 4 chambers: right atrium, right ventricle, left atrium, left ventricle, and cardiac muscles. And over that you can see the right coronary artery, circumflex artery, left anterior descending artery. These are all coronary arteries. Coronary artery supplies the oxygen and nutrients to the heart muscle itself. Heart muscle is otherwise called cardiac muscle. This is the same picture, you can see. Are you able to see the pictures?
Yes, sir. Yes, sir.
Yeah.
Yes, sir.
This is actual, when we open the thoracic cavity, heart looks like this. It will be beating, and surrounding the artery, there is a yellow deposit is there, no? That is the fat. And if the fat contents or high cholesterol occurs, it compresses the artery from outside also, not only from inside, from outside also. See, people all know this Kapalabhati Pranayama. This is more important for me. You take slow and normal inhalation, that is deep breathing, and exhale quick and forcibly. When you take inhalation very slowly, the oxygen goes deep into the alveolar tissue, that is in all the parts of the lungs, and when you exhale quickly, you will exhale the carbon dioxide as well. So at the same time, I want to tell about the muscle acting during Kapalabhati. So one is neck muscles, second is intercostal muscle, that is chest wall muscles, and diaphragm. Diaphragm means it is a partition between the thorax and the abdomen, and the abdominal muscles. These are all the muscles acting. When you take deep breath in, the intercostal muscle, that is chest wall muscle, relaxes, diaphragm goes down, neck muscle relaxes, thereby it increases the vital capacity of the lung so that you can inhale more of air. When you exhale very fast, this diaphragm contracts, goes up, and intercostal muscles contracts, is causing squeezing of the lungs tissues, and that's how carbon dioxide is exhaled. And if you are having any doubts in between, you can ask the questions. And coming to this heart, see, heart receives deoxygenated blood. Deoxygenated blood means there is lot of carbon dioxide in it, no oxygen or less oxygen. From the into the right atrium, from all parts of the body through superior vena cava and inferior vena cava. From right atrium it enters the right ventricle. Can you make out right ventricle? And through the right ventricle it enters the lung via pulmonary artery. See here, the pulmonary artery, though it is an artery, it carries deoxygenated blood. Usually all arteries carries pure blood, that is oxygenated blood, except pulmonary artery, it carries deoxygenated blood to the lungs. In the lungs, the gas, oxygen, carbon dioxide gas exchange occurs, and through the pulmonary vein, it enters the left atrium and to the left ventricle. And when the heart contracts, the blood enters the aorta and supplies all the tissues of the body. So whenever there is valvular deficiency, the heart regurgitates. That means when it pumps the blood, some amount of 30 to 40% will come back and causes heart dilation. In that case also, we will have less oxygen, respiratory rate increases, and heart rate also increases. And this is the coronary artery. I have already shown over the heart. So when you do the angiogram, this looks like this. So left one is right coronary artery, left and this right side is right coronary artery, and circumflex artery, lateral descending artery, like that. So whenever there is a block, the angiogram, there will be block. The angiogram shows further circulation of the heart. This is the angiogram. This is actually normal. You can make out. Same diagram. This is the diagrammatic representation. This is the actual angiogram views. And this is the diseased blood vessel. So I have shown that earlier. Normal, left is normal, right is diseased. Blood clot is there, diseased artery. Now you can make out, you can make difference between the normal artery and abnormal artery. See here, the inside the endothelium, there is a lot of cholesterol deposit is there. We call it as plaque. So whenever there is lack of oxygenation or obesity, high cholesterol, even blood pressure, the blood pressure makes the artery very stiff. So the RBC sticks to the wall of the endothelium. Along with the platelets and the RBC, cholesterol deposit and also the plaque formation. Whenever there is tension or high BP rises, these plaques get dislodged and enters the further coronary circulation, causing the heart block, sudden cardiac arrest sometimes, and even the heart attack. So, pranayama contraindication, that is where you should not do pranayama. When the blood pressure is very high, you should not do pranayama. And recovery from recent myocardial infarction, that is recovery from the heart attack. Severe stress, during stress you should not do. Fatigue, that is weakness, you should not do. Acute illness, whenever you are having high fever or any other acute illness like gastroenteritis, vomiting, you should not do pranayama. So here you can see the coronary artery. Whenever there is block, partial block, you will have chest pain. So actually there was a study in Chandigarh by a cardiologist. He took nearly 100 patients wherein the angiogram shows 50 to 60% blockade. Not above 70 means you have to intervene, you have to do stenting or bypass surgery like that. He has chosen where only 50 to 60% blockade patients. So out of which 50% were given the conventional allopathic treatment like giving blood thinners, antiplatelets and low molecular weight heparin, enzymes, etc. The remaining 50% they are subjected to spiritual medicine. Spiritual medicine means transcendental meditation, that means pranayama only, different yogasanas and chanting the Om and hearing the light classical music. So this is for 3 months. After 3 months, this angiogram was repeated. The result come out was equal to the conventional allopathic treatment with that of the spiritual medicine. So there is a reversal of blockade from 50 to 60% to 30% in each group. This is how the pranayama equally helps. So pranayama should be done before any blockage occurs. That means it can prevent heart diseases, lung diseases and even cerebral diseases and cerebrovascular accidents. Cerebrovascular accident is again the rupture of the blood vessels or blood clot in the blood vessels. So I am not going in detail with the brain sections. So this is the important aspect of this one. Whenever you do transcendental meditation, when you are normal, you can prevent getting heart block, heart diseases, lung diseases like that. So when there is already block, it helps to improve your conditions. But if the block is more than 70%, you have to consult a cardiologist and go for the interventional treatment like angiogram, stenting and bypass surgery if needed. If bypass surgery is done only if there is more than 2 blocks. There are sometimes, I have shown the 3 vessels. All the 3 vessels get blocked, triple vessel blockade. In such case, there is no option, you have to go for bypass surgery. I think I can close here at this moment. I invite some questions from the audience.